it's obvious that you both have been saying now that this is a very challenging time and that people just don't seem to be listening to you when you're saying don't gather indoors. What are the consequences, or what are the impacts that you can further impose to try to make people get this message? Because it doesn't seem to be working right now.
Yeah, there's a lot of different parts to it, and it has been a bleak winter, and it's been hard for everybody. But we are into a hopeful spring, and now that we are into spring, we need to focus on the things we can do, and we need to go back and think again about how we can do things safely, and at this point more than ever, to protect each other. So yes, there's lots of things we can do outside right now. Go outside and play, as I've been saying all along. Those are the things we need to think about. And those are things that we can do safely. We have heard that some people are planning celebrations and parties and weddings and other things in the near future. And really, we need to remember that we are not out of this woods yet. We cannot be thinking about those things. And we, in public health, will be taking a concerted effort with our partnerships with WorkSafe BC to make sure that we are holding establishments to account for their safety plans and for things that they're doing, because we know that it puts their own their own employees at risk, as well as the people who are coming to these places. So there's a number of things that we are working on, but we are going to be consistently. We've talked about, what types of things can we do that will make a difference, and where we're seeing transmission. Some of them is really important. We've talked about it a bit. Part of it is through our immunization, but also our outbreak management, and having vaccines, particularly the AstraZeneca vaccine, gives us another tool in part of our outbreak management. And we've seen that in action. It works, but it also takes time, and it means that right now you cannot let up on those COVID safety plans. But we are also seeing transmission in that spills over into places in our community, whether it's restaurants and pubs or gyms or some of the other social settings. Even we've seen clusters related to some of the youth sports settings. Again, not the kids so much, but in the adults and the parents who are around those settings. We're also focusing our attention on where we know the risk is highest, and that's the areas where that the transmission in the community is highest. And it may not be a large number of people, but if I'm somebody who's working in a high-risk environment, and I go home and I live in a crowded house or a house with multi-generational families, big families, which is really wonderful and exciting, my risk right now of passing that to people in my household is much higher than it was a few months ago. So we're trying to tackle it at all different parts, and people need to understand that, and we will be out making sure that businesses who are part of this whole transmission chains right now are part of that as well.